Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet Dr. David Butler, who's a new pediatrician at Seashore Pediatrics. We'll also meet Terry Mazingo and Lindsay Harris. Lastly, we'll meet with Leslie Bradley, who is the manager of patient access at Novant Health Brunswick Medical Center. So stay tuned to learn about valuable health topics with HealthWatch. Our first guest for the day is Dr. David Butler of Seashore Pediatrics. Well, welcome to the show, Dr. Butler. What a pleasure to have you here.
Thank you very much.
Well, I'd like to start off by finding out how long you've been here. I think you're a newbie, right?
Yes, I've been here 3 weeks now.
Wow, and we've had great weather, so you're probably really happy with
Yes,
that.
it's been great.
Great. So tell me, what brought you to Brunswick County?
It's a nice area. It's a beautiful area. It's a smaller town atmosphere, which my kids and myself really enjoy, and it was just a great opportunity for us.
Well, wonderful. We're happy you're here too.
Thank you.
You're welcome. Well, let's talk a little bit about your education and your background. Tell me, where did you go to school?
I went to Marshall University in Huntington, West Virginia,
Wow.
and I achieved a bachelor's in chemistry there. And then I got my doctoral degree from the West Virginia School of Osteopathic Medicine. And after graduation, I did my residency at the WVU Charleston Area Medical Center in Charleston, West Virginia.
Wow, you're a proud West Virginian.
Yes.
I can tell. I can tell. And of the herd, right?
Yes, ma'am.
Well, I know that you've joined Seashore Pediatrics with Dr. Ludlow, and he was on our show not long ago, actually. Do you have other partners there at the practice?
Yes, we have Dr. Young and Dr. Sanger and Dr. Richards as well.
Quite a few of you there then.
Yes.
Well, I'm curious, where are you all located?
We have 3 offices. The one I'm mostly at is in Charlotte on 3650 Express Drive. And then we have offices in Loris and Long, South Carolina as well.
Well, being a parent of older children now, of course, but when I had young children, I was always worried about sick visits and worried about, waiting to get up in the morning and make that call when the office opened. Tell me how you operate with sick visits. What's your process?
If you're our patient, we try our best to get you in the same day. So if you call that morning, it is our goal to get you in if you have a sick child, because our thought is if you come see us, we should be there to accommodate you when you need us the most.
That's a wonderful philosophy.
Yes.
And when you're on call, do you take your own phone calls?
Yes, we do. We alternate which provider takes phone calls, but we have someone on call 24 hours a day.
So if a viewer out there had a small child, a patient of yours who was sick, and they placed a call to you, it's likely they would get you or one of your partners right on the phone then. Is
Absolutely.
that correct? I think that's very unique, and I think that's, if I were a new parent, that's exactly the kind of practice I would want to be involved with. So I applaud you for that.
Thank you.
I think that's wonderful. And I also think I heard that you guys have different waiting areas for sick children versus well children. Tell me about that.
Yes, we do. We have different waiting rooms. One is a well visit waiting room and the other is a sick visit waiting room. So if you're there with a sick child, or excuse me, if you're there with a routine visit, you're not sitting beside other children who might have the flu or strep or things like that. So your child shouldn't become contaminated with germs.
Yeah, there's nothing worse than bringing your child in for their little checkup and they end up getting sick from their checkup.
Right.
So I think that's wonderful, especially this time of year, which leads me into my next topic of the flu. And since we're kind of in flu season, give us some insight into how you prevent kids from getting the flu. Is there anything you can do?
The biggest thing is prevention, and the biggest thing to prevent it is the flu vaccine. And this year we have two types available, the traditional injection form, and then we have an intranasal form too. So instead of getting a shot, kids can come in and it's a mist that's sprayed into their nose. Now there are criteria you must meet before you're able to receive that. You can't have any ongoing asthma or lung conditions with wheezing, and you have to be older than 2 years old. But if you meet those, you can avoid the typical injection that we associate with the flu vaccine.
Oh, yeah, I was wondering what would make that decision whether you would have the shot, the injection, or the vaccine. Do they both work equally well?
Yes, yes they do. They're both very effective.
Well, that's good to know, especially for those kids who don't like those needles. You know,
Absolutely.
That's great. I wondered what do parents do if they find out their child does have the flu? What would be some of the things they might have to do?
If you suspect your child has the flu, we encourage people to come to the office right away. There is a medicine, which is rare for a viral infection, but there is a medicine for influenza. And if we can confirm it is the flu, we're able to start that. And if we start it within the first 48 hours of symptoms, then it is very effective to cut down the duration of the illness and the severity of it. If you're outside of that 48-hour window, the biggest thing is just take care of your child. Lots of fluids. Warm fluids are very good. They feel better on the chest. And then fever control.
And typically, how long does the flu last?
Typically, it can last a week to 10 days.
Wow.
The worst part of the symptoms are generally the beginning, the first 3 to 5 days. But it can last as long as a week.
Yeah, nothing worse than a sick baby at night and with the fever, and that's a long time. So, well, that's really great information. I'm sure our viewers will find that very interesting. Getting back to you, I was wondering, do you have any special interests or areas of focus that you are particular about?
My favorite is newborns.
Of
I love
course.
newborns through toddlers, and they remind me of my own children.
Of
so
course
I
they do.
enjoy those the most.
Well, Dr. Butler, are you and your partners currently accepting new patients?
Yes, ma'am, we are.
And how might they schedule those appointments? Do you have a phone number?
They can feel free to call us at 910-754-BABY or 2229.
I love that phone number. It's baby is so easy to remember.
Yes, yes.
That's great. Well, Dr. Butler, it's been a pleasure to have you on the show today.
Thank you.
I look forward to seeing you again real soon. We'll have you back, and maybe we'll talk about sunburn in the summer, right?
That sounds great.
Okay, great. Thanks again for joining us.
Thank you for having me.
You're welcome. Our next guests are Terry Mazingo, registered dietitian at Novant Health Brunswick Medical Center, and Lindsay Harris, a student working with Terry. Well, welcome to the show, Terry and Lindsay. It's such a pleasure to have you here.
Thank you. Thank you
You're
for inviting
welcome.
us.
You're welcome. Well, I'd like to begin by telling our viewers a little bit about your education and your background. So let's start with you, Terry.
Okay, well, I'm a registered dietitian, and I work for Morrison, and I'm the regional clinical nutrition manager. And I've been at the Brunswick Hospital for the past 3 years. But my original studying began in Canada because I'm Canadian, and then I did my undergraduate at ECU.
Oh, I didn't know you were Canadian. That's interesting.
From Nova Scotia. And so I work at the hospital, and then I also work at a private practice in Wilmington with eating disorder patients.
Wow, that's interesting. And so you've brought Lindsay here with us today. And Lindsay, I understand you're an intern and you're working with Terry.
Yes, ma'am. I'm a distant student at Lenore Ryan University in Hickory, North Carolina, doing my dietetic internship with Terry for a total of 9 months until May. And when I'm finished there, I'll sit for the registered dietitian's exam.
Well, great. It's just a pleasure to have you guys here, and I'm excited to get started. So, Terry, now I know you said your role at the hospital, you have three separate roles. I wonder if you could elaborate on that a little bit.
I do wear multiple hats there. I just recently got promoted to the regional clinical new manager position. So I am responsible for 6 other hospitals, taking care of all their dietitians.
Oh, wow, that is a big
It
responsibility.
is a big responsibility. But I'm also the clinical nutrition manager at the Brunswick Hospital. So I'm in charge of all of the clinical medical nutrition therapy for all the patients there.
Uh-huh.
And I'm also the patient service manager. So anybody in the kitchen, I help them make sure that all the patients get great service. So those are my big roles there.
Yeah. And what's your role in all of this, Lindsay? Everything else that doesn't fall into those 3
pretty
categories?
much. No, I have 3 rotations to do. I have a food service administrative rotation, then I have a community nutrition rotation, and then a clinical nutrition rotation. I'm finishing up my food service now. I'll start my community next week, and then after the new year, I'll start my clinical rotation, and then I'll be finished.
Well, great. Terry, I'm curious, when a patient comes into the hospital, how do you determine what type of diet that particular patient might get?
Okay. Well, typically the doctor is going to prescribe a diet, and it's usually based on their disease state, meaning do they have diabetes, do they have heart disease, do they have any kidney or renal problems? And once those diets are prescribed, they go into our kitchen, and when a patient calls down, we have a program called Dining on Call, which patients can call basically like room service, and our Dining on Call associates will help them choose foods that meet their diet criteria. And it's really important for those patients to follow that diet because it's actually helping in their treatment. It's like medicine, so we kind of view food as their medicine. And we also follow up through their stay by providing education, so hopefully that they're going to follow through with those tips when they get home.
Well, now you mentioned Dining on Call. So are they given something to follow? Do they choose from a list of foods that are appropriate for them?
Well, we do. Our menu right now is like a room service, so they do receive a menu in their room. And when they read that menu and they call the number, the Dining on Call associates will let them know if it meets their diet criteria. So a diabetic will only have so many carbohydrates they can choose for a meal, and a cardiac will only have low sodium choices and low fat choices to choose from, and our associates will help them kind of look through the menu and see what's right for them.
And if they had a question about what the offerings, would they be able to talk with you if necessary?
Absolutely. All patients have the ability to request a visit with a dietitian, or even if they pass it on to the Dining on Call associates, they'll let me know, and then I'll go up and do a visit with the patients and help them out.
Well, that's good to know. That's good to know. Now, oftentimes you see on TV all these advertisements for these supplements, and I won't mention a product, but is that an option at the hospital? Would there be times where a patient might have to have something like that?
Absolutely. We always want to do food first. It's always the best. But there's times when patients, they can't eat by mouth. Maybe for some reason they maybe had stomach surgery, or the doctors don't want them to eat and let their stomach rest for a few days. So sometimes we do what we call enteral feeds, where they may have a tube placed in their nose or in their belly, and we give them supplements or nutrition to help them heal from whatever they're at the hospital for. But other times we don't want to use their tummies at all, and we are going to use what we call TPN, which is total parental nutrition, or PPN, and that goes through one of their veins. So you don't actually feel yourself being fed like you would with the other products, but it's really important that patients receive that to help shorten their stays at the hospital, because good nutrition is really one of the first defenses in getting people out quickly.
And when you say that, I envision this milkshake going through this tube and
Some of
into
them do look like
their
milkshakes.
arm. And I'm curious. So some do have
some of the
color and
some of the products can actually be taken either orally or through the tubes. Now, the ones that go into your veins, those are specific, and they only go into your veins. But there are other products that have different flavors and textures and tastes that can be used for all sorts of reasons. And more interestingly, some of them now can actually be used in baking and making meals.
Wow.
So if people get bored with just drinking like milkshake type drinks, you can bake with them like muffins or cookies or soups, and get a little creative with what you're having.
Well, I'm curious, and this may be a dumb question, but if a patient is hungry and you feed them by one of those methods, do they feel full?
If we're feeding them through a tube, either in their nose or their belly, yes, because it's going directly into their stomach, and they will feel that sensation. However, when you're feeding them through one of their veins, they don't feel, and that's kind of difficult for some people because they still may feel hungry even though we're giving them the nutrition, but we're not allowed to use their stomachs. We call it gut rest.
Oh, and there would be, like after surgery, so a big belly or surgery, you might have to rest
We
the
really
gut,
have to rest
so-
that gut. And it may be for a short period of time, but sometimes people are on them a little bit more indefinitely, and it could be up for several weeks depending on how well they're healing.
So no pumpkin pie for them?
No pumpkin pie for them.
Pecan pie?
We do have some flavored pumpkin supplements.
Really?
So just like you'd go get your pumpkin latte or spice latte from Starbucks, sometimes we can doctor them up and so they're a little bit more tasty for patients.
Well, I'm just used to seeing those things on TV about Ensure and all those products that you drink, and they all look so young and stuff, and they're drinking Ensure, and I'm thinking, I should just eat something.
It's tough. For patients that don't want to eat, these are a great
I never
alternative.
thought of that.
This is a great alternative because most of them are typically high in calories and have a lot of nutrition, so they don't have to eat or drink a lot to get what they need. So that sometimes is a great substitution. Sometimes people just need a little bit extra, like our cancer patients. So those are just helpful. And they are supplements are typically not in place of the rest of their actual meals.
Well, we're happy to have both of you on the show today, but we specifically wanted to talk about healthy eating during the holidays, which are just around the corner. So I wondered if either of you could give us some tips about healthy eating during the holidays.
Sure. The main thing is just to be aware of what you're eating and plan ahead. If you know you're having holiday parties or whatever, just plan ahead and consider that into your whole day, not just that meal. Don't go to the parties starving. Try to snack before you get there. Be aware of your portion sizes. And one thing I think a lot of people don't think about is don't drink all of your calories. Those holiday punch and those things eggnog can really add the calories quickly. So just be aware of what you're eating or drinking.
Yeah, we go to parties and we see all that luscious stuff and we just start snacking and one thing leads to another and you've eaten 3 meals.
3 meals in 1 meal, absolutely. That's very typical in Thanksgiving. We usually typically eat more than a day's worth of calories in our Thanksgiving dinner meal. So we want to remember that we want to keep it simple and space those out throughout the day.
Just don't eat all day except for
don't
that
eat all
one
day.
meal, right? Well, Terry, what might be some healthy alternatives for some of our favorite traditional foods, like at Thanksgiving, as you mentioned?
Absolutely. One that we like to do, instead of the green bean casserole, which everybody loves, is maybe substituting some sautéed green beans. You can save probably about 300 calories by just switching that recipe up. Also, another favorite, instead of the pecan pie, is going to pumpkin pie. And you're also going to save about another 150 to 200 calories per slice.
Wow.
And I know that Lindsay had just mentioned about the alcohol. One good tip is just switching between an alcoholic and a non-alcoholic beverage throughout the day. Because like Lindsay said, it's really easy to add those calories up quick. A few other ones would be with turkey. You may want to eat your white meat and not your dark meat. There's a little bit more calories found in your dark meat.
Well, my favorite thing is stuffing, though.
That's a tough one. It comes in with all the extras that you're adding into your stuffing. So if you're adding in a lot of dried fruits or nuts, you just want to make sure you're not going overboard because they add a lot of calories in a really small package.
And you can also substitute sometimes in certain recipes chicken broth for the butter or the margarine, depending on the recipe, especially like mashed potatoes, you can use chicken broth instead of butter and milk.
Yeah, I love stuffing. I mean, I could make a meal on that. And I love pecan pie. So
I know, that's a hard one. So maybe you just want to go with a smaller slice.
Yeah, because pumpkin, I'm thinking not.
It's not your favorite.
It's not my favorite. Not my favorite. Well, let's talk about after Thanksgiving and after Christmas comes New Year's. And we all start out with January 1, we're going to go on a diet. And by January 5th, we're done. It never works. So, how can you help me?
Well, I think the best thing is to start before Thanksgiving and not really think about losing weight over the holidays and more maintaining your weight. So if you go with that philosophy, hopefully the New Year's, you're not starting off backwards. But when you get to the New Year's, just remember we're doing small steps and make your goals really achievable. So if you're aiming for a 20-pound weight loss, we may only want to start with 5 and see how we do. And working with a buddy is always really helpful.
Yeah, the holidays, I'll always lose weight before the holidays. And then I put it right back on during the holidays. And then January 1, I got to start all over again. So it's not working for me. I need a new plan. So, Well, thanks again for being here. I hope you'll come back and join us.
It was a pleasure.
We'll go through another great topic.
That's wonderful. Well, happy holidays.
Thank you. Thank you. Our last guest today is Leslie Bradley, Manager of Patient Access at Novant Health Brunswick Medical Center. Well, welcome to the show, Leslie. It's such a pleasure to have you here.
Thank you.
Let's start by learning a little bit about you, about your education or your background and where you came from.
I've been in the medical field for a little over 20 years. I managed a billing company for durable medical equipment for over 10 years in Greer, South Carolina. Before that, I worked in pharmaceutical clinical trials. I was a project manager for over 8 years in New Jersey. And I recently relocated to Wilmington over a year ago and worked in mental health, and now I've relocated to Novant.
Wow. Got a lot of experience there and
Yes.
some different, all health related, but just all different things. That's great. Well, let's talk about your role at the hospital. What is it that you do at Brunswick Medical Center?
I am the manager of the Patient Access Department. We do all registrations for outpatient procedures, inpatient admits, the emergency room, and any surgeries. So we'd register the patient, gather their insurance information, and make sure everything's in the system so they can have their procedures done.
So basically, everybody that comes to the hospital to be either admitted or utilize our services come through your department.
Yes, they do.
That's a big responsibility. Well, how long have you been with Novant Health?
6 months.
6 months. Well, that's great. Now, our main focus today is for you to tell me about something new. I understand it's some kind of a right patient software, and then something about an iris scanner. I can't wait to hear about that one. But so let's start with the new technology being introduced at Novant Health. So
We will be installing digital cameras on every registration desk. When you come in for your registration, you'll have your photo taken and it will scan your iris at the same time. And that will link to your permanent medical record.
So it'll be done at each registration desk. There'll be a scanner.
There will be a digital camera, just looks like a digital camera, and we will take a photograph. And it will be at every registration desk and on our mobile carts that we can take into the rooms.
Oh, so like in the ER, because they do bedside registration,
Yes.
right? So it'll be on that. Well, tell me about this scanner thing. So how does that work? The camera just points at you and do it, or do you have to like put your eye up?
No, the camera
how's that work?
we just point the camera at you, we take a picture, and there is a scan. It just scans your
At the
iris
same time?
at the same time. Patient does not have to touch any equipment. It doesn't hurt, and they won't feel anything.
They don't feel anything.
No.
Okay, so when they come back for like the next visit, what happens then?
When you come back for your next visit, we would just do a scan. We don't do a photo. We just scan your face, and it will pull up your medical record.
And so you know that you always have the right patient for the right procedure at the right time.
Yes.
And all that stuff. So that's what that right patient software is. It recognizes you. Well, I know they have that a lot of other places. I've seen it like on TV and different things, but typically they'll put their eye up against this thing. But
No,
that's
you
not
don't have to do
necessary
that.
here. And they don't feel anything.
No.
Well, tell me, why did Novant think that was important to implement this iris scan?
It's to increase our patient safety and our patient security, and there's the security of their medical records.
Well, the patient safety that you're talking about, tell me a little bit about that.
Is to ensure that when you come in, we do have the correct patient.
Because like two people could have the same name,
Same
right?
name, same date of birth. It happens all the time. And
Really?
we want to ensure that, yes, we want to ensure that we are registering you under the right patient account, that you will be billed properly, and it also will help prevent theft of your medical records or fraud.
Yeah, I know a lot of times when you come into the hospital or you go to the doctor's office, they ask you the same thing, the same questions over and over and over. And I understand that's a patient safety thing just to make sure that every time you change hands with a different tech or a secretary or whomever, they have the right person. And I guess with the iris scan, it's probably even more secure.
It's more secure, and the patient doesn't have to have another form of identification with them.
Really?
Once you're scanned the first time and you're in the system, you would not have to present any other identification after that.
Well, that makes it simpler. I think folks get tired of asking or having to provide their driver's license or
yes.
whatever. And is the insurance information in there then? So you would just like update it, just say if you changed?
Yes, if you changed your insurance, we would update your insurance when you came in for your visit. But as long as all your information is the same, when we do the iris scan, it pulls up your full medical record.
Now, is Novant using the iris scanners in any other facilities?
Yes, all the Charlotte area hospitals
Like-
have gone live.
Like Presbyterian?
Presbyterian, they all started with the iris scan in July.
How's that working for them?
It is working very well.
And how do the patients perceive it? Are they,
They've only had 2 or 3 patients actually say no, that they didn't want their picture taken. One lady was because her hair was not fixed that day. But they haven't had a lot of patients say no.
really?
Once they've explained that it's for their security and to protect their records, they're very open to having their photo taken.
So they're bringing on all the other facilities once.
About every 2 weeks, a new hospital's going live.
And when might we expect to see that at Brunswick?
We will go live November 11th, 2013.
Well, that's just right around the corner.
Yes, it is.
Gee, I can't wait. But it won't happen until you come. You wouldn't call people in to
No.
do all that prior to, just as you're coming in for a procedure.
As you're coming in for a procedure or anything, when you're coming in, we will scan you, take your photo then, and update your record.
Now, I know you said that there have only been a couple patients who have declined having their picture taken. Has anyone declined the iris scan or said, I just don't want to do that? Or
Not to my knowledge. I've reached out to the other area hospitals that have gone live, and they said it has gone very smoothly, and they've really had, the patients have been very engaged in having their photo taken.
So what would the procedure be if they absolutely refused to do that? What would you do?
We would just say, okay, no one is being forced to have their photo taken. If they do not want to have a photo and an iris scan, that's fine, but when you would come in for registration, you'd still have to have those additional forms of identification so we could make sure you are the correct patient.
So there would still be safeguards in place to make sure you have the right patient with the
Yes.
right, but you would use the old methods.
Yes,
And so again, you say it'll be November?
November 11th.
Okay, and they'll be at all the computers, you said at all the individual registration computers, but I was wondering would there be a kiosk or something otherwise?
We will have a kiosk in outpatient, but that is to make payments and to confirm appointments. They will not have an iris scanner on the kiosk, but that is where they can come in and make payments if a financial counselor is busy or a registrar is busy and they don't want to wait.
Really?
And if you just want to come in and confirm your appointment.
Oh, right there in the at the entrance to the outpatient.
Yes.
Oh, I didn't know that. That's great information. Well, you told me it's November the 11th, and so I'm excited about that. I can't wait. That's exciting information. So is there anything else going on, anything new going on in patient access that you want to tell us about?
Not at the moment. That's the biggest thing going on, and that's going to be pretty big for us the month of November.
Yeah, and then I guess electronic medical record may be the next thing.
That will be the next thing.
And that'll be coming before you know it.
The end of 2014, I believe.
Yeah, I'm excited about that one too. Well, thank you so much for being on the show today. It was a pleasure to meet you, pleasure to have you here, and I hope that you'll come back and talk to us about the newest piece of technology that comes down the pike.
Thank you so much.
You're welcome.
It was a pleasure being here.
Thank you. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email those to atmctv@atmc.coop. For more information on Novant Health Brunswick Medical Center, local doctors, and general health information, please visit novanthealth.org. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.